response times in trailer park communities of zip code 30040. I'm telling you, my mind is blown. This is absolutely amazing. Medea?
Hi everyone. My name is Medea Raza, and I'm a rising senior at Alliance Academy for Innovation in Cumming, Georgia in Forsyth County. And today I'm excited to share my research project with you, which is titled Investigating Slower Response Times in Trailer Park Communities of zip code 30040. This project is part of my work with the Child Health Equity Initiative, and it's something I became passionate about after noticing a big problem happening right in my own neighborhood. So here's how it all started. I live in the zip code 30040, which is a suburban neighborhood. But just a few miles down the road, the scenery really changes. There are trailer parks clustered along the streets, communities that are home to mostly Hispanic and low-income families. Over time, I got to know some of the people that live there through the lawn work that they do in my community or the cleaning services. In conversations, a few of them shared something that really surprised me. Ambulances take much longer to reach them. One man told me it took him over 15 minutes for EMS to get to his father, who was having a diabetic emergency. And that really stuck with me. I knew I wanted to understand why this was happening and what could be done to fix it. My research question was pretty simple. First, I wanted to measure the difference in EMS response times between trailer parks and suburban areas. Second, I wanted to find out exactly what was causing the delay. And finally, I wanted to come up with practical solutions that could actually help these communities. So that led me to my research question of how does living in a trailer park in zip code 30040 affect how quickly emergency help arrives compared to other neighborhoods in the area? I took a mixed method approach to my research, using both observation and data. I used Google Maps and GIS tools to study the layouts of different neighborhoods and road access. I also looked at public EMS data and created a simulation to estimate response times. On top of that, I spoke with 6 residents that live in these trailer parks and 2 Forsyth County EMS responders. And their stories gave me a real understanding of what happens during an emergency call. I then compared all of this to the layout and response data for suburban neighborhoods in the same zip code. My findings were clear and really concerning. The average EMS response times in trailer parks was about 12.4 minutes, while in suburban areas, it was just 7.4 minutes. That's a 5-minute delay. And in a life-threatening situation, like a heart attack or a stroke, those 5 minutes can be the difference between life and death. When I visited trailer park neighborhoods, I noticed a few patterns. Streets were narrow, signs were hard to find, and many homes didn't have clearly marked addresses. So even if EMS teams are nearby, just finding the right house can take precious time. To give you a bigger picture, zip code 30040 has 47 mobile home parks. Compare that to the zip code 30041, which is right next door. It has fewer than 10. But despite serving the same county, EMS response times in these areas are very different. I also found that trailer park response times varied a lot more, between 11.7 minutes and 13.1 minutes, while suburban neighborhoods stayed pretty consistent. And that inconsistency can create even more stress during emergencies, especially for families who often feel overlooked. So what does all of this mean? It means that the delay isn't because trailer parks are farther away from EMS stations. It's because of infrastructure. Poor signage, confusing addresses, and unmapped lots make it harder for responders to access these areas. And that's a health equity issue. And it shows how the design of a neighborhood can directly impact survival. One thing I didn't expect to find was how emotional this issue was for its residents. Some people told me that they feel invisible, like the system wasn't built for them. After learning all of this, I wanted to focus on solutions, things that can actually be done to help improve the EMS systems in these communities. And here's what I came up with. First, Forsyth County could update 911 and GIS systems so that every trailer park unit is mapped correctly. Second, we could use reflective visible address signs for all trailer homes. Third, placing EMS units or float zones closer to trailer parks could shave off those extra minutes. And finally, distributing Spanish language 911 instruction cards could make communication smoother in a crisis. And what's the best part? Some of these ideas, like the signage upgrades, are already being explored at the county level. To wrap up, EMS response times are 5 minutes slower in trailer park communities than in nearby suburban neighborhoods, even within the same zip code. And that delay isn't just about distance, it's about overlooked infrastructure. With some small but meaningful changes, we can make emergency care faster and more reliable for these underserved communities. This is a fixable problem, and solving it could save lives. I'd like to thank Dr. Wimberly and Dr. Smith for being incredible mentors throughout this entire process. And I'm so grateful to the residents who's trusted me with their stories and to the EMS staff who shared their insights. And of course, a big thank you to the TELP program for making this research possible. If you have any questions or want to learn more, feel free to reach out, and thank you so much for listening.